The most accurate indicator of successful fluid resuscitation in a dehydrated child is. Correct answer is option C, urine output. A child with nephrotic syndrome is most prone to. Correct answer is option B, infection and thrombosis. Which acid-base disturbance is most common in severe diarrhea? Correct answer is option B, metabolic acidosis. The most common cause of chronic renal failure in children is. Correct answer is option A, congenital anomalies of kidneys and urinary tract. Which vaccine is contraindicated in severely immunocompromised children? Correct answer is option C, MMR vaccine. Which congenital heart disease causes severe cyanosis immediately after birth? Correct answer is option C, transposition of great arteries. A child with acute glomerulonephritis should have. Correct answer is option B, restricted sodium intake. The priority intervention in a child experiencing a febrile seizure is. Correct answer is option C, maintain airway. Which electrolyte abnormality commonly accompanies severe diarrhea? Correct answer is option B, hypokalemia. Which disease is associated with strawberry tongue and desquamation? Correct answer is option A, Kawasaki disease. The most common organism causing osteomyelitis in children is. Correct answer is option B, Staphylococcus aureus. A child with coarctation of aorta typically has. Correct answer is option A, weak femoral pulses. Which vitamin deficiency causes hemorrhagic disease of the newborn? Correct answer is option D, vitamin K. The classic triad of intussusception include. Correct answer is option B, abdominal pain, vomiting, current jelly stool. The hallmark finding of Hirschsprung disease is. Correct answer is option A, delayed passage of meconium. In meningitis, the most serious complication is. Correct answer is option C, increased intracranial pressure. The priority nursing intervention for epiglottis is. Correct answer is option B, maintain airway. Which electrolyte imbalance is most dangerous in acute renal failure? Correct answer is option C, hyperkalemia. A child with sickle cell disease develops chest pain, fever and hypoxia. This is. Correct answer is option B, acute chest syndrome. The most common cause of death in children with Dacry muscular dystrophy is. Correct answer is option B, respiratory failure. Which finding is characteristic of increased intracranial pressure in infants? Correct answer is option C, plugging fontanelle. A child with beta thalassemia major requires repeated transfusion. The major complication is. Correct answer is option A, iron overload. Which acid-base imbalance is typically seen in pyloric stenosis? Correct answer is option C, metabolic alkalosis. A child with teratology of float squirts after exercise because secreting. Correct answer is option A, increased venous return and systemic vascular resistance. In Kawasaki disease, the most serious long-term complication is. Correct answer is option B, coronary artery aneurysm. The earliest laboratory finding in iron deficiency anemia is. Correct answer is option B, decreased ferritin. A child with nephrotic syndrome develops sudden abdominal pain and fever. The nurse should suspect. Correct answer is option B, peritonite. The definitive treatment for heart-spring disease is. Correct answer is option C, surgical removal of ganglionic segment. The most common cause of congenital hydrocephalus is. Correct answer is option A, aqueductal stenosis. The best indicator of fluid replacement effectiveness in dehydration is. Correct answer is option B, urine output. Which condition is characterized by persistent proteinuria and edema? Correct answer is option A, nephrotic syndrome. The classical triad of teratology of float includes cyanosis due to. Correct answer is option A, right to left shunt. Which disease is associated with strawberry hemangioma? Correct answer is option A, benign vascular tumor. The characteristic feature of pyloric stenosis is. Correct answer is option B, projectile non-bilious vomiting. The priority nursing action during a seizure is. Correct answer is option C, protect from injury. The hallmark laboratory finding in iron deficiency anemia is. Correct answer is option B, microcytic hypochromic RBCS. The first sign of increased intracranial pressure in infants is. Correct answer is option A, bulging fontanelle. The most common cause of congenital hypothyroidism is. Correct answer is option A, thyroid dysgenesis. Acne muscular dystrophy is inherited as. Correct answer is option C, X-linked recessive. Which electrolyte abnormality is common in diabetic ketoacidosis? Correct answer is option A, hyperkalemia. Which disease is associated with a slap cheek rash? Correct answer is option C, fifth disease. The most common childhood brain tumor is. Correct answer is option B, medulloblastoma. The classic symptom of correctation of aorta is. Correct answer is option B, weak femoral pulse. Which disorder is characterized by absence of ganglion cells in the intestine? Correct answer is option B, heart-spring disease. The most common cause of acute glomerulonephritis in children is. Correct answer is option B, streptococcal infection. The most common cause of neonatal sepsis is. Correct answer is option B, group B streptococcus. The normal fetal heart rate range between. Correct answer is option B, 110 to 160. The most common cause of postpartum hemorrhage is. Correct answer is option C, uterine atony. A newborn is considered low birth weight when weight is. Correct answer is option B, less than 25,000 gram. Which congenital heart defect is characterized by machinery-like murmur? Correct answer is option C, PDA.